Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Can young men have sexual weakness? Yes, we see them a lot. Why can somebody have sexual weakness? Yes, let's now talk about the mechanism of erection. How can somebody get an erection? You know, erection is about blood flow to the penis. So when the penis is erect, that means there is blood flow going to the penis more than normal when the penis is lancet. What does that mean? What kind of blood? Arterial blood. So that means there is another kind of blood? Yes, there is venous blood. Arterial blood is the oxygen rich, nutrient rich, and is the high pressure blood that is delivered by something called arteries. So we have an inflow of arterial blood into space inside the penis. And then what about the venous blood? We have to limit the outflow of the venous blood, meaning we have an inflow, something coming in, which is arterial blood. We have an outflow, which is blood going out, which has become now a venous blood. After all the nutrient and the oxygen has been extracted from it, it becomes venous blood. So it goes to the veins. That's a low pressure system. So now, in order for me to reach erection, I have to increase the inflow of the arterial blood and decrease the outflow of the venous blood. That is mechanical. This is like plumbing here. Huh? This is plumbing. Nothing difficult. In order for me to get erection, I have to increase the inflow of the arterial blood, decrease the outflow of the venous blood. In this case, I will have an erection. The more the arterial blood going in, the less the venous blood going out, the stronger the erection. So we know all it's about the blood. So now let's find now why would somebody have an impotence. So if the erection is all about arterial blood inflow, then we have to see what can compromise that. Well, we have the heart. That is the biggest bump in the only biggest bump in the heart, the body that pumps out blood. So if somebody have a heart problem, like heart failure, whether is reduced ejection fraction heart failure or increased ejection fraction heart failure, forget about the fancy terms. If you have a heart failure, your heart is not working right. Can that affect the inflow of arterial blood going to the male sex organs? Yes. So that means will be less inflow of the blood going to the penis? Yes. Can that lead to weaker erection? Yes. So the heart has to be good. What delivers the blood from the heart to the penis is the blood vessels, the arteries, the veins. What if I have an inflammation or a disease in the peripheral vascular system? Will that affect my delivery of the rich, high pressure arterial blood into the penis? Yes. As a result, I will have a weak erection. What if I have diabetes? With a high cholesterol, that now the vessels that deliver this blood into the penis become narrower than normal. Will that affect the delivery of the arterial blood into the penis? Yes. So the patient then cannot have diabetes, long-standing diabetes, complicated with increased lipids, and talking about we're going to have good sexual life. No. So that means your weekly fasting blood sugar, when even when you're young, you know, it should be done, because those are small things that can easily be prevented. Because once we have atherosclerosis, which meaning decrease of diameter of that artery that deliver the arterial blood into the penis, close or partially closed or occluded with all those cholesterol and sugar, when they combine together, is horrible, because it's like solidify. It's like this table here, very tough. So who can remove that? Nobody can remove that. Now we have fancy surgeries and fancy, you know, procedures that so advanced that we can do revascularization of the male organ, the penis. We can do revascular, meaning what? We're going to bring new vessels and then we remove the old vessels. But is it done here in Africa? I'm not aware. And why would we go all the way far to do that if we can prevent it by something small in the beginning to live a healthy life all your life? So checking your blood sugar, see, checking your blood sugar has something to do with impotence. Checking your blood pressure has something to do with impotence, because again, impotence, sexual weakness, is about the blood that gets into your penis. So whatever carries the blood, whatever pumps the blood out, whatever responsible for decreasing the diameter of that artery that reach the penis and cause the erection, all of those factors are responsible for good erection. But you know, you said hypertension, you said heart failure, you said diabetes, you said high lipids, you said all this, but we have a young patient here. How can a young patient, 20-something years old, suffering from all those diseases, one of them or two of them or all of them, you know, this is less likely, right? And you're absolutely right. Less likely a man of this age will suffer from something like that. Absolutely correct. Then what is the problem? If he cannot have all those diseases, and you said this is the most common causes, or the, you know, because it's about blood and what carries the blood and what delivers the blood and what pumps the blood. And this young man have a healthy heart. He doesn't have diabetes. He doesn't have peripheral vascular disease. He doesn't have high lipids in his blood. Why then he is sexually weak? He's been for a year or two, that to the point that his girlfriend has complained. It's not working for me. You know, let's define what is good sexual erection. You maintain good erection to penetrate and ejaculate after few minutes. Premature ejaculation, that's always another symptom that accompanies the sexual weakness. Premature ejaculation, like the name suggests, you ejaculate before time. What is time? We say 1 minute. So sometimes even people ejaculate before reaching penetration, or immediately after penetration. They don't finish 1 minute. So that's when we say premature ejaculation, we're talking about 1 minute. We're not talking about now, okay, I do 10 minutes, that's normal. So the definition is 1 minute. You ejaculate after 1 minute. From the beginning of the intercourse, 1 minute or less. That is premature ejaculation. But premature ejaculation is always something that is accompanied by the weak erection. So back again to the point, let's not deviate. How you explain then this young man having sexual weakness? Then we have to say this is psychological. If you have noticed during the interview with this man, I asked him one question. Early morning, do you have an erection? Yes. So you have a good erection early in the morning, but you cannot maintain the erection during the sexual intercourse. Now this is psychological. Psychological. Remember what I told you before at the beginning of the session? I said it's all about the head. You must be relaxed to have a good sexual life. If you're not relaxed, you cannot have it. And this is very common among men. Not very common. We said third of the population, and now young men are on the rise to have sexual weakness. And believe me, it is not organic, meaning it is not because of organic disease like we have discussed a bit earlier, just a minute ago. It is psychological. Can we have a solution for that? Yes, we can have a solution for that. It's very easy. It's no problem. What is the solution? We're going to do therapy. We're going to do therapy. Okay, meanwhile, we can jumpstart him with some medication. to have the strong erection and to have the delayed ejaculation. Okay? Let me tell you something. Erectile dysfunction, weak erection, is a symptom of depression. When we talk now about psychological causes, the whole erectile dysfunction, the whole symptom of erectile dysfunction, it is nothing but one of the symptoms of depression. What is depression? Loss of interest. Among those interests is the sexual desire. He lost interest. So this is a symptom of depression. Does that mean everybody out there, young people, who have sexual weakness, can we call them depressed? Because they have lost interest in, not necessarily, but erectile dysfunction is a symptom of depression. So how are we going to treat? Oh, we treat depression by giving a group of drug called SSRI. But what if I tell you that among the strongest SSRI, which is selective serotonin reuptake inhibitors, it's a group of medication. Let's call them antidepressant. Among one of the best out of them that we usually use, this medication that we use for depression can cause erectile dysfunction. So if the doctor is not careful and treating depression, he's going to actually worsen the sexual weakness. So what we do, you have to be careful in what drug to choose to take away the depression and maintain the sexual health. Because can any other drug, for example, a medication that is used for hypertension, the guy, he was fine before you put him on this medication, and then now that he's taken this medication, he is no longer able to erect. Talking about an older man now. So antihypertensives, some of the antihypertensive meaning the medication that treat high blood pressure. Some of those medications can actually cause erectile dysfunction in older men that are hypertensive. So what is the big thing here? When you see your doctor, you tell your doctor, doctor, I am not interested in a drug that will kill my sexual desire or cause me sexual weakness. I want a drug that can not interfere with my sexual health. And that will be great. Then the doctor will understand, oh yeah, it's supposed to be like that. If the man is still, sexually active, and nobody out there should not be sexually active, your sexual health is important, and you should maintain it. There is no reason for anybody out there to tell me I'm old and I cannot have sex, or I accept the fact that I cannot have sex. No, there is no such a thing. Such a thing doesn't exist. It's either somebody mistake by giving you the wrong medication that causes sexual weakness. So I treated the hypertension, but I caused sexual weakness. Is that good? Absolutely not. I treated the depression, but the guy now is, that's it, impotent. It's not good. Why? Because there is always alternatives. Meaning, instead of I giving you antidepressant that causes sexual weakness, I'm going to give you antidepressant that has nothing to do with sexual weakness. So we choose which one to give and which one not to give. So this is, now, let's now talk about how can impotence happen. Let's talk from the head, from the desire. The desire is where? In the head. When you have sexual desire, it happened from where? From the waist down? No, the waist down is just as a result of what's going on in the head. What is going on in the head? Desire. Desire has to do with the head, because all the substances that causes you to have a sexual desire for someone is in the head. You see something, you hear something, you touch something. Those are all stimulants that have stimulated some centers in the brain. As a result, some hormones are released. Those hormones will go stimulate the testes, and the testes will then produce testosterone. That is the substances, that is one of the most important substances, if it's not the only one, that is responsible for your sexual desire. So when a man comes to me and tells me, I have lost desire, then I already know that there is something wrong with testosterone. Then I will look at his testes. Maybe his testes are small, hypogonadism. Then I will look what is the reason that your testicles become small. We'll investigate then the hormones that are coming from something called the pituitary gland. We investigate the hormones that is coming from the hypothalamus to stimulate the pituitary gland. We investigate the LH and FSH, luteinizing hormone and follicular stimulating hormone, and its effect on testosterone. It's complicated, but glands and endocrine and the head has a lot to do with it. Down the waist is only mechanical, and it responds to hormones. Those hormones is testosterone. Testosterone is responsible for sexual desire. Is testosterone also responsible for erection? Yes. Low testosterone, low erection. High testosterone, high erection. So that means it's good to take testosterone, right? Well, go ask those who are bodybuilders. They exercise their muscles, and some of them, not all, they get so addicted to the big muscles. They want more and more and more. So what they do? They shoot testosterone. It gives you the muscles. It gives you strong bones. But what is the side effect? What is the price you pay? It's not going to give you sexual desire. You know why? Because this excess of testosterone inhibits and kills the testes not to secrete any more testosterone. Remember when I told you in the beginning, use it or lose it? Now I'm somebody who is taking external testosterone from outside, and this is an advice for those who shoot testosterone to build muscles. I'm taking testosterone from outside by any form, oral form or IV form. So I'm telling the testes to shut down, because testes only respond to low level of testosterone. Then it will secrete its own. But if I give it testosterone from outside, so I'm basically telling the testes, hey, I don't need you anymore. Stay aside. I'm already taking it from outside. And the monitors and the sensors in your body sense that there is testosterone in the blood. I don't need to secrete anymore. So based on the rule that said use it or lose it, I don't need to make testosterone. I become lazy. I atrophy. I become smaller over time till I disappear. So this is what we call hypogonadism because of external other causes, secondary hypogonadism. This is one of the examples.